Okay, now let's discuss our readings. This is our reading screen where we read our actual measurements that are going on in the circuitry and in our client. It's in scroll mode. To take it out of scroll mode, hit select, and you can look at each one individually and study as you need. So let's take a look at the map. Mean airway pressure. This is the amount of pressure that is in the circuitry and in your client's lungs, which is an average over last 60 seconds. Think of your map akin to a diastolic pressure. It's more relevant to long-term indication of what's going on with your client, and is mostly used by pulmonologists and respiratory therapists, but it is very useful reading. Now let's look at our PEEP. PEEP is positive end expiratory pressure. And this is the residual amount of pressure that's left in your lungs after your client exhales. We all have PEEP, and PEEP is very important. It maintains our lungs, our alveoli open. If your alveoli were to exhale and close all the way, they would get stuck together, and you would have a very hard time getting them to reopen. That's called atelectasis, or collapsed lung. PEEP is extremely important. It's normally set at about 5 for most clients. Our exhalation valve for the LTV 950 has a PEEP setting on it. The proper way to set your PEEP is through your exhalation valve. You press down on a yellow disc and turn the cap of your exhalation valve clockwise to increase your PEEP. As you see, I've just increased it from 5 to 6. 5 is the normal for most clients, but it could vary based on doctor's orders. To lower my PEEP, I would press down and turn it counterclockwise. Now we see we've lowered the PEEP now to 3. Let's set it up a little higher to a normal value of 5. Okay, now let's look at our breath rate. It's notated as F on your reading screen, but it represents the breaths per minute. As you can see right now, it's breathing at 10, as we have it set at 10. Sometimes your patient may breathe above this, so your setting may be 10, but he's actually doing 12 or 13. This is actually a good sign. Now let's look at our exhaled tidal volume, VTE. It's easy to read backwards, expired tidal volume, but it represents the amount of air in milliliters that has been exhaled or came out on each breath. This is a very useful reading. It tells us what's going on with our client right at this point in time on each breath. The tidal volume, as you can see, was set at 420 milliliters to be infused. But this tells us how much actually came out. So by looking at how much came out, it gives us an idea of whether our client is getting the actual prescribed amount on each breath. And it will change. A client who is twisted, or a client who has changed his position, or a client who may give some resistance at any point in time on any breath, this will change. It's constantly changing. But it should be within close proximity. We have an artificial lung or balloon that's attached to our ventilator at this time, which does not have the same or consistent lung compliance that a client would, and so the numbers are quite off, but they should be relatively close. Also, when you look at this, what comes out versus what was prescribed to be blown in really shows the difference or the volume of how much leaked out somewhere on your client. That leak could be from your client's stoma, where he's attached, his trach is attached. He may turn his neck left or right. He may be in a different position, and it may cause some leakage, which would account for it. The balloon on his trach may not be fully infused with saline, and there may be some leakage. That could also account for the difference in the numbers. This number can also be higher, as you see. If a client coughs, it can cause a high pressure alarm, and it can also show a number quite higher than what's prescribed. That's because when he coughs, he adds in some air to what came out and shows a higher expired volume, and it's a temporary scenario. This could also have a lower number if you had some leaking within your circuitry somewhere. So this is why we do a leak test prior, but looking at these numbers and comparing them is a very, very valuable way to assess what's going on, not only with your circuitry, but most importantly with your client at that point in time. Let's look at your VE. This is your minute volume. It's also an expiratory volume, but your VE is a measurement in liters versus milliliters of how much your client has expired over the last 60 seconds. And this value is also something that's more of a long-term indication and is more useful to our pulmonologists and respiratory therapists when they decide to make some changes. The IE, or inspiratory expiratory ratio. This is also a measurement that shows the length of time that it takes for expiration versus the length of time that it takes for inspiration. Your V-calc. The V-calc is something that's also much more useful to your respiratory therapist. This is basically your client's peak flow on each breath. PIP, peak inspiratory pressure, another very extremely useful reading for our nurses. As you can see, the PIP reading is 31. This is the maximum amount of pressure that is infused or is inhaled by your client on each breath. Another, with this is scrolling and you want to see your PIP, it's also shown on your graph here. As you can see, it says right about 30, and each time, every breath it changes. So whether you're scrolling or not, you can always see what your PIP is, your peak inspiratory pressure, at any moment or on any breath by looking at your graph. It's a very, very useful number. This gives you an indication of the amount of pressure in your client's lung. So when pressure increases, there are certain things that can cause high pressure increases. That would be congestion, pulmonary plug. It could also be a crimping or obstruction in your lines. But when you see your PIP increasing, then you should be concerned to take a look and listen to your patient's lungs to see if there's any congestion that might be building up. It's a very useful indicator that you can look at any point in time that will clue you in to listen to your client's lungs and see why it might be rising.